Managed Care by Teresa Sickmyre. To understand managed care, we must first understand the history of insurance in the United States. In 1927, a group of physicians, health economists, and public health experts were put together under the title of a Committee on the Costs for Medical Care. By the time they were done in 1932, they had accumulated 28 volumes of reports that included the summary of the solution for the American people. During that time, they were only using 4% of the gross domestic product in health care as compared to today, which is 16% of our gross domestic product is being used. They wanted to make sure that American citizens were using all the services that they needed, but they were falling short in all income levels, but the most hit were the poor or the African Americans. So what they determined was they needed a consumer-driven system where the risk share or the cost was shared with several groups and it was accumulated over time. This was financed by cost sharing at a reasonable rate for each family or individual. The first insurance company was Blue Cross Blue Cross, and it started in 1932. With the success of Blue Cross, there became more and more insurance companies involved in the next 2 decades. They were all related with employment, but the main cost came from the individuals themselves. However, after World War II, unions fought to have health insurance covered in collective bargaining, and employers taking the majority of the premium costs. In 1965, Medicare and Medicaid was adopted to cover those Americans who were unemployed or were unable to work. By 1965, 80% of the population had insurance that would cover hospitalizations. Insurance companies continued to grow and continued to be unregulated. 1970 was the beginning of regulation for insurance, and the growth in cost per capita continued to grow out of gross proportions. The managed care solution. Managed care was initiated in the 1990s to slow down the growing costs and expenditures that were happening with Medicare and Medicaid. Employers wanted to control the cost of insurance and its premiums, and also the services that were being used with insurance to kind of control what they were putting into it. Fee-for-service insurance then became extinct. Managed care theory is to control the price of services and payment to physician, control utilization of services, and integrates the financier, the insurance providers, and payers. So it makes it more integrated, makes the fees more usable, and everybody knew what the fees would be and the charges would be for each of the employers and the individuals with the insurance. As managed care grew, so did the opposition to managed care. There were thousands of legislations in various states between 1990 and 1999. One of the legislations was the Mother and Baby Care Act of 1996. What this was about was to prevent insurance companies requiring mothers deliver and go home within hours after a delivery. The legislation instated that the mothers who had a vaginal delivery should stay 48 hours, C-section 96 hours. Another legislation was the gag rule prohibitions. This prevented practitioners or physicians or hospitals from letting patients know of other care from other facilities outside of their network or their integration. With all this legislation, consumers were caught in the middle. There was so much legislation changing and so many different products from different companies, from different insurance with the different PPOs and HMOs, that you were never really sure what was covered and what wasn't covered in your insurance. As time went along and things got a little bit more difficult to get care, There was integrations, alliances, and mergers, and networks were formed between physicians, hospitals, insurance companies, and the consumers. Another thing that came along with managed care between the 1990s and 1999s was the prevention of stenting. What stenting would do would not pay for care outside of your integration or out of your HMO or PPO. The stenting opposition allowed for an appeal process for emergency coverage if you were out of town, for example, and you had an accident or you needed care at another facility that was closer. Several of the legislations kept managed care from dealing with the increase in care costs by making set fees from each facility within an integration. The different kinds of managed care options, the first one being the Health Maintenance Organization, which is HMO. It has a fixed monthly fee, a small copay, a range of services that depended on the plan that the employer had or that you had privately owned yourself. It was fragmented between place to place. You must stay within the network that your plan requires, and there are exceptions for the time of the emergency. That is the stenting that's in place with that. The Preferred Provider Organization, which is PPO, it is the one that we most have in the United States. It is a fixed monthly fee. Usually larger co-payments are included with the PPO. There's more choices of provider selection or specialists. There is also an out-of-network portion with the PPO, but it will cost the individual more out of pocket. For example, there'll be a deductible for your regular plan and then a separate deductible if you go out of network. The third one is a point of service plan. It limits choices but has much lower premium. You can be referred out of network with limited cost coverage. An individual must fill out your own claim forms, so you must track your own receipts, the times of your appointments, and the charges that you will bill, and you negotiate directly with your insurance company. The pros and cons of managed care. The pros are that it does show a cost saving for the individual. If you have no major chronic illnesses, you go in and pay your copay and you know what you're going to be billed. They can't overbill you for that. The managed care process does slow down the rate of growth of expenditures by keeping the fees at a certain rate throughout the insurance integration or process and network. There is a good access to preventative care, as most PPOs and HMOs have a clause for paying for routine care such as immunization, physicals, and overall good health care practices. There's fewer billing issues, as when you pay your copayment, then the facility will go ahead and work with the insurance company to retain the rest of the payment. The cons with managed care is you may have a longer time to wait for specialists within your network, as you can't be referred outside of the network without an increased fee. There is an increased cost for out-of-network choices. Whether your network has that opportunity or not, if you go out of network, there will be an increased charge with the deductible. There's limits of expenditures on certain diagnoses, such as mental health, over a certain period or the lifetime of your insurance policy, dental care, and certain vision diagnosis. So our future with managed care, insurance in general, it's an increased integration between physicians and hospitals. As resources are getting less and the increase in the population is more, they're seeing the benefit of physicians and hospitals and other companies coming together and coming up with plans to better cover insurance. True collaboration between the managed care and the providers should happen in the future. The Affordable Care Act is not 100% active, but it's slowly on its way, and it will slowly allow for more coverage for more Americans. However, insurance in the United States is still pretty fragmented, and it's hard to keep track of who has what insurance and what coverage they might have. There is an increased responsibility in the future by society to keep ourselves healthier. So we're looking more for prevention, we're looking more for wellness, and to maintain cost ourselves and not overuse what we can use on our insurance. Solutions need for higher population needs and decreased resources with rising cost of health care is an ongoing issue in the United States as well as internationally. In summary, the health insurance has been a debatable issue since the 1920s. It's not anything new to our nation on how to use our health money and how to get care to our people. There's been thousands and thousands of attempts by legislation to control the rising cost and the care that the Americans receive, whether it's not enough or if it's too much. The future is a growing unhealthy society with increasing medical needs and costs as our society in America increases in heart disease, obesity, and the illnesses that come along with that. As we have an aging baby boomer population, our costs will go up. We really need to look as a nation as an increased look towards prevention and wellness. And there's a larger responsibility for individuals to improve our own health to decrease the rising cost of health care. Thank you for listening to this presentation, and I will end it here.